Welcome to MeloTV. My name is Gershon Kutsi. Joining us in studio is ENT Specialist Dr. Raphael Mlauzi. He's been with the Melomed family since July, but already feels like he's part of the family for longer than that. Welcome to MeloTV.
Thanks, Gershon, for having me here.
Great having you, Dr. Mlauzi. Let's talk about a procedure that you just recently done on a patient, Kurt Dreyer. You're talking about it, a majory resection.
Yes, it was a patient who came in with a long-standing history of more than 10 years of a slowly growing mass on the neck. It was quite a big mass. It was pushing the trachea. It was pushing structures around it. And he said he was a bit concerned about coming to hospital for some time. But yes, we ended up doing it.
Dr. Mlauzi, just smiling about the procedure. I was asking him earlier, do you ever get nervous about when you go into procedures? He says, no, I'm like an athlete. My heart races a bit, but always in control. But let's hear from Mr. Dreyer. It's the very first time that he actually went to surgery, and he talks about his experience being under the knife with Dr. Mlauzi.
I'm Kurt Dreyer, 48 years old, and I'm a single parent. The good news is the lump was there for over 15 years. It wasn't cancerous at all, but the dangers that it holds was it could have stopped me from breathing properly, eating properly, pressing against the vein. And after the conversation with Dr. Mlauzi, he advised me to get it removed. And it's there where I decided to do so. I was scared because of me being a single parent. It's my first time that I'm going into a hospital in my life. Dr. Mlauzi reassured me that it is safe and I don't have to have fear. So at that time I felt very comfortable and decided to do so. Seeing the lump after the operation, I couldn't believe the size of it. But now when it's finally removed, I move more in confidence. I'm glad I met up with Dr. Mlauzi. That assured me once again that I don't have to worry about this thing, to get it removed and to give me a much healthier lifestyle.
Dr. Mlauzi, just hearing Mr. Dreyer talking about the procedure, he was nervous. He's a single parent, and that's the first time he's ever gone to surgery.
Yes, he did say that he kept it for quite some time because he was worried what would happen to his children if he undergoes surgery. But we had to reassure him because most of the surgery these days is done very safely. It's quite very safe procedure under controlled conditions with professionals around. You know, it's a good team, good nurses, good anesthetists, so much support around. So we had to reassure him first that no, it was going to be well, and then he ended up agreeing to the procedure.
Talking about Mr. Dreyer also, itself, the mass that grew over years, it was massive in his neck. That was pushing down on his accessory nerve, which could have also stopped his shoulder movement.
Yeah, that's right. It was quite a massive lipoma, which was pushing around the structures. The masses are divided into two. Tumors in medicine means growth. So that growth can either be benign or malignant. So it's the malignant ones that tend to eat into structures and metastasize to the body. But then his was a benign one. So it actually causes pressure effects around. So as you know, all the structures that come from the brain to the body, they pass through the neck. So obviously there'll be pressure on the accessory nerve, pressure on the nerves around the neck, pressure on the trachea, pressure on the esophagus, pressure on so many structures. So that's why it was important for it to be removed. And he felt that it was the time for it to be done. Yes, that's right.
We're talking to Dr. Raphael Mlauzi, ENT Specialist at Melomed Bellville. But hearing patients saying that this is the first time I've been in theatre, I now have quality of life, I can be more confident.
That's what keeps us going. That's what keeps us waking up every day and going to work, because it is that kind of difference that you make in people's lives. That's important for us. I mean, his was a complicated mass. It was actually spanning, we divide the neck into levels, level 1 to 6. It was spanning all the levels. And it was going back behind the sternocleidomastoid muscle to level 5. So it was quite a challenging mass because it's been there for a long time. There was some fibrosis around. In other words, structures were stuck together because this thing has been growing around for quite some time. So resecting it, we had to do it, as you correctly said, about the shoulder, movement by the accessory nerve. we had to do it under accessory nerve monitoring just to make sure that we don't leave him with an impaired shoulder movement and to minimize whatever complications he had. So we took quite some time. We took about an hour to take the mass out, and thankfully the surgery was successful and we have a happy patient.
Dr. Mlauzi, I've seen photographs of the mass that was removed. As you said, it's been there for a very long time. It was probably this big, and it could have affected his breathing.
Yes, no doubt about it, yes. That was the danger, that, he would have fortunately, would have slowly, felt some obstruction on his trachea when he was breathing. And fortunately, at this point in time, he was not feeling like that, but we explained to him that there is that danger, that, it can press on your trachea and the other surrounding structures. And that's why he ended up agreeing to the surgery.
Now, Mr. Dreyer, who we interviewed post-operation, also works as a caretaker at a high school. He's a qualified carpenter, and he only had wonderful things to say about you and the staff at Melomed Bellville. Let's quickly hear what Mr. Dreyer had to say.
Yeah, I'm a carpenter by trade. But now at the moment I'm a caretaker at Symphony High School. When I decided to remove it, or when I went into the operation and came back home, my children were happy for me for doing this, taking this big step, because they know I'm a scared person. The children in the school didn't even, not at the moment, they didn't take note of that because I'm wearing a buff. So they don't know I have this little scar now by removing this big lump. But as time goes, I will starting to remove the buff, and most probably then they will see and ask questions. Once again, I can thank Dr. Mlauzi for encouraging me to do it. I want to thank the Melomed staff for the wonderful service that they rendered to me, and I appreciate it. So I can move around in more confidence and more relaxed without knowing people are going to ask me, what is it in your neck? Because my answer on the end of the day was, oh no, it's a lump. But now it's successfully removed. So I'm quite happy with the service that was rendered to me.
Well, there you heard Dr. Mlauzi. Once again, you said it earlier, it's what gives you that oomph when you come to work again. It brings you joy knowing that you've made a difference in someone's life. Mr. Dreyer, just being so thankful for the work that you've done.
You're welcome, Mr. Dreyer. He was quite a wonderful patient, so it was very nice to actually treat him. And I'm very happy because he's had a smooth post-operative course. He didn't have any complications post-operatively. His wound healed very nicely. It was quite wonderful to have you, Mr. Dreyer.
Our guest is Dr. Raphael Mlauzi. With such a name, I know that he also plays tennis like Rafael Nadal. So Raphael Mlauzi, tennis is one of your hobbies.
Yeah, it is one of my hobbies. Yeah, not like Nadal, but close. I hope one day I'll be there. It's actually my favorite player, not because we are both namesakes, Raphael, but I just happen to like him quite a lot. I've been watching him since he burst on the scene around 2004, somewhere there, when he won his first French Open. So yeah, that keeps me going on weekends. I take family to Edgemead Tennis Club, and then we do social tennis on Thursday afternoons. Quite a nice club, very friendly people. I really enjoy myself there.
ENT Specialist Dr. Raphael Mlauzi, almost said Rafael Nadal. As an ENT specialist also, you work with children, Grommets?
Yes, we do Grommets for children. That's one of the commonest causes of conductive hearing loss in children, a fluid behind the eardrum. So these children, they tend to lose balance. They've got poor hearing. They've got slurred speech. So it's not slurred speech, sorry, delayed speech development. And so it is quite important that this is diagnosed as early as possible. Once it's diagnosed, we have to put in Grommets, depending on how severe the speech delay is. But it is quite one of the common conditions that we deal with as ENTs. Yeah.
So a mom and dad is watching this video right now and saying, oh, Grommets, I just heard doctor speaking about it. What is the procedure though? Yes,
the procedure is that we diagnose it and then we take the child to theater. We put the child to sleep so that they don't feel anything. And then once they are asleep, we use a microscope and then have a look in the ear, clean up the ear if there's any wax, have a look at the tympanic membrane. That's the membrane that vibrates when someone speaks, that transmits the sound into the inner ear through the middle ear. And then we make a small incision on the tympanic membrane, and then we put these very tiny tubes called grommets. We put them there to drain all the fluid. So these grommets tend to come out within 3 to 6 months, normally after all the fluids have come out. And so the parents always ask what will happen to them afterwards. No, you tell them, no, they will come out on their own. You don't have to worry about them. The only complication of that being infection. So it's quite important for the soapy water when they're bathing the child for the water not to get in. Otherwise, we rarely see those complications. But it's quite a successful surgery, and the parents really appreciate it almost immediately. They see the difference in the child's hearing and the child's speech.
You also have children grinding their teeth. You have children snoring.
Yes. Children who snore is because of normally it's because of huge adenoids and huge tonsils, but there could be other causes like children with a T21 Down syndrome, or malocclusion, or so many things that can go wrong that can make the child actually snore. Anything that affects the upper airway. So it is important that these children be evaluated as soon as possible, do a sleep study or take a history from the mother just to assess how severe it is. Once you have ascertained how severe it is, then you can either give them medical treatment or give them surgical treatment. The surgical treatment involves taking out the adenoids and the tonsils. That's one of the most satisfying operations we can do, actually, because a child has been snoring for such a long time. You take them to theater, put them to sleep, take out the adenoids and tonsils, and the mother will tell you that for the first time, my child was sleeping and I didn't even hear a sound, almost immediately after the operation. So that's one of the very satisfying surgeries that you can carry out as a surgeon. Yeah.
As an ENT specialist, also tonsillectomy, tonsillitis. I had mine removed when I was 12 years old, I remember. You couldn't swallow, very sore. The best part is it was done at Melomed Bellville when I was 12 years old, because my mom worked there for 30 years. Having ice cream and jelly the next day.
Yes.
But yeah, tonsillectomy.
Yes, that's right. Tonsillectomy, that's one of the commonest indications, actually, recurrent tonsillitis. It's been found that those children who have more than 7 tonsil infections in a year, or 5 every year for the past 2 years, or 3 every year for the past 3 years, they actually benefit from having them removed. It's not everyone who gets recurrent tonsillitis who qualifies to have the tonsillectomy. But you are lucky because they were done when you were young. I mean, the pain is much less severe. I don't know how much of it you remember.
I just remember the ice cream and the jelly.
Ice cream and the jelly. But if it's done to adults, it's quite painful in adults. But, well, it has to be done. I mean, if they are getting recurrent, tonsil infections, tonsillitis, or if they've had, a quinsy that's pus collection around the tonsil, then that's one of the indications that you actually have to take it out. Yeah.
You can hear a man with so much wisdom. I know your journey to becoming a doctor wasn't an easy one either.
No, it wasn't an easy one, of course. There were many of us in our family, so there were always, economic challenges and so forth. But those fall by the wayside. If you look at what one has to achieve, what one is aiming for, the aim is always, to look for what is ahead. In other words, have this inspiration that, you can do this. I mean, even with limited resources, we didn't have internet by that time, to get textbooks, to get things photocopied, to look for information to use in the exam. It was quite difficult, but, it is that passion, that knowledge, that belief in oneself that, no, I can do this, I can do this. It was one that drove me, and I'm very happy that everything fell into place.
Dr. Raphael Mlauzi, thank you so much for joining the Melomed family. Thank you for not giving up, because the Melomed family has been enriched with a wonderful doctor who wishes that he can go on tour with Raphael Nadal. Contact details of Dr. Mlauzi is on your screen. As always, thank you for watching this video. Please like it and share it. And until next time, God bless. Goodbye.